Okay, well, what's your name and where are you from?
Okay, Jody Larson, and I'm from Blaine.
Yeah, why don't you tell us what all you had when you came in, what you were like, what you had.
Okay, so I started out with being very bent over, walking
Yeah.
very slow, huge limp,
Yes.
and everything was kind of low back, left side of um, of my leg.
Essentially could not walk.
Correct.
I mean, had
Yeah.
no ability to walk.
And I had to have someone drive me
Right.
because I was very
And-
nut.
And what did the MRI show? Do you remember?
The MRI showed that I had, let's see, it was T5 and S1
L5.
or
L5.
L5
Yeah.
and S1 herniation,
Yeah.
and then there was some bulging in the L3 and 4.
Yes. And were these small?
No, they were huge.
Huge, yeah.
I remember you telling me that these were really big.
Mm-hmm. The word is extruded, and the nerve, the gel material, I literally was sitting on your nerve, and you had two levels of it, so you had two different nerves.
Mm-hmm.
That's why you couldn't walk. Anyway, what did you do?
So I came in here and you did some adjusting and you told me about Vax-D.
Yeah.
And so I went through the first series of Vax-D.
Yes.
And I was walking better and feeling better, but I wasn't completely done with it.
Right.
And so then I started another session, and that I think it took me over to the point where I was like, I'm really getting better.
Yeah.
But then it took another month or so for me to really feel the effects and maybe increase my walking. And I have a small foot drop now, and it was a big foot drop before.
Right. Closing the gaps. When we started, you couldn't raise your foot.
Oh, that's right.
Remember that? You just didn't have the ability. And now you can raise, but it fatigues, but the power is being turned on, and you're absolutely right. It's continuing, and I think you're doing physical therapy exercises now just to stabilize. And so it's really close the gap. So how are you doing now from a pain standpoint? You're just telling me that?
Yeah, the pain is like, I was at like 9s and 10s, 8 9s and 10s, and I am down to 0 to maybe a 4 in my back. And that comes after I try to do a little bit too much walking. And the leg is doing 100% better. That's at a 0.
Yeah.
The numbness in the foot is probably like a 1 to sometimes a 4 when it gets really tired. But doing the exercises has really made a difference. Learning how to retrain my brain to activate those muscles or nerves.
Yeah.
Yeah. So.
And this is about, you told me, I think it's about 4 months.
I think so. It was April 28th.
Okay.
That we started.
So so you've closed the gaps a lot. You're going to keep healing, but it's great to have this little update. What would you recommend to somebody that had what looked to be 2-level surgical intervention, but what would you recommend?
Oh, I would say come in, be faithful, I think twice a week, 3 times a
Amen,
week.
yeah.
And do the Vax-D, do the chiropractic, do the Vax-D, because it really does make a difference. And at first you just don't know what's going on in the Vax-D, but once you get used to it, I actually felt like, oh good, tomorrow's Vax-D.
Oh good.
So it does relieve a lot of that pressure, and I would recommend it highly.
Well, thank you so much. All right, bye-bye.